everyone hear me? Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Suheir Kafri, and I'm the social worker at the Adams Center. Just a little introduction about what the Adams Center is. The Al-Dalis Area Muslim Society was developed in 1983. A small group of families in Harrington and Reston, Virginia got together and thought we needed something, like a platform to begin prayer services, and so the Adams Center came about. Today, mashallah, it's a masjid as well as a non-profit 501c3, and it serves well over 6,000 families. We have 4 branches in Virginia, and mashallah, every Jum'ah we put out 10 satellite offices that also continue prayers throughout Virginia and DC. So just a little introduction. I know a lot of people start by some storytelling, but in 2014, I answered kind of an innocent ad that said Adams Center is seeking a social worker, so I was very excited about that, and I responded to that ad, and I thought how wonderful. There's a social services in a masjid, and so I can't wait to work with my community, especially being someone that came from a background, I'm a second-generation refugee. So my parents are Palestinian, and they were in Jordan. I was born in Jordan, and then I was a first-generation immigrant to the U.S. And so I don't know who it was in the first session. I forgot, forgive me, but they said, you can't have all of this, this whole package, and then not carry trauma and not carry, just say, oh no, everything is fine. So our whole lives here really in the U.S., we've been kind of grieving a self that was actually. And so my whole life I was listening to so many stories about what used to be, and it's always such a long process of grieving. And then kind of becoming these new people in a new land and trying to acculturate. And so when I realized that there was an opportunity to work in the masjid, I felt like this is probably something where I can go and be myself and meet so many people that are probably experiencing the same thing. The first time that I got together with Imam Majid and our other imam, our sheikh at the masjid and our executive director at that time, I said, all right, so where do I start social working with the community? And they said, no, you have to develop the department. And I was like, oh, okay, so I thought that it was already set and developed. And so basically I sat in an office with a desk, a chair, computer, and a phone. And I opened my door and I waited for the community to come in. I don't have any data tools or research other than myself and what I encountered through my experience with the community and my conversations and the trauma that I witnessed through them that they brought to me to talk about once they found out that there was a social worker in their masjid. So I began to develop a social services plan initially, and what I did was, and then the Adams Wellness Center came through that, was birthed through that. And so in designing their social services department, I took the family services that's in every county, really, and that is your emergency assistance, your Medicaid, SNAP, job resources, and mental health. And I said, okay, we're going to have to do this in the masjid if they want full services, social services department here. And so what we came up with was the emergency assistance is the zakat. We're in the masjid, so the zakat assistance is the charity that we received through the community. And that is initially how I started, really getting to know the community, was they would come in seeking rent assistance, or my power bill is about to be cut off, or my child's registered in the local community college and I cannot pay for him to go, I need help. And so through my interaction with them, I began to hear their stories and began to realize there's so much more underlying. And so that made me go in and say, okay, we need mental health, but I kept that kind of on the shelf shelf for a while until we could develop the social services department. ACHN is the Adams Compassionate Healthcare Network, and some of our community members in Adams formed a free clinic, and so I would just refer them to now. So I had a resource, and alhamdulillah for that. The Wellness Center was what was to come. We developed a food pantry, and I partnered with our capital area food bank and signed a contract with them, so I would just shop at 19 cents a pound from them and bring it to the masjid. And that was basically our idea of SNAP assistance, which is the food stamps, job empowerment, resume writing workshops, and then the education is ESL classes, and then the wellness seminars that were to come later on. I wanted to kind of always refer back to something, and for me, working in the masjid, this was something that made sense to me, because the Travis's iceberg model had the very bottom part of it was the spiritual realm. And many people that came to talk to me they came to the masjid for a purpose. They came for a reason. Although even if everyone's level of religion and spirituality was different, they still came to their masjid. So I had to keep that in mind. They're here in the masjid. We have a musalla. The adhan is being called. So this environment is something that they came to for a reason. All I was seeing was that top state of health, whenever they entered. But what I was able to get to know was everything else underneath. And getting to know them, they were really my reason for developing anything from the masjid. The barriers, when I started talking to the community about why don't we refer you somewhere, why don't you go seek mental health counseling, these are the reasons that they started telling me. So the stigma, my family can't find out that I need mental health care. What will people say about me? They'll say that I'm crazy. My spouse doesn't approve of me seeking counseling, which was, everything was very heartbreaking to hear, because everything was about what will others say about me if they knew I was in counseling. And all of this went back to people think I'm crazy if I'm going to go seek counseling. There was a huge language barrier. They don't understand what I'm saying. I say one thing, these are people that have actually tried to go, I say one thing and it's misconstrued. I don't speak English very well. The cultural sensitivity part was also very big, because they were afraid to talk. They were afraid to say anything that might get them in trouble. They would say, I'm going to be in trouble if I say this. They're going to think that I'm not a good person, or that I'm an abusive person, or that culture played such a big role. So, they would tell me they don't understand how important our culture is, and I don't want to change my thinking. I don't want to change the cultural value in my family. And so, fear. That was also very heartbreaking. My spouse will use it against me. So what if my in-laws find out? What if my husband tells my in-laws that I'm seeking counseling? Or, what if my wife tells my in-laws that I'm seeking counseling? They were always afraid that it would be also used against them in custody for those that were going through a divorce process. The health insurance, of course, and the financial factor were very, very big obstacles. A lot of people came to me without health insurance, and so they did not have mental health coverage, and if they were able to go to emergency mental health, they were, I believe, granted like 2 sessions, which really doesn't do anything, once you go and you talk to someone. The financial obstacles, even if they did have insurance, they would say, how can I go once a week and pay $50 as copay, and that's $200, that's my electric bill. So for me to go talk to someone, or for me to pay my electric bill, I think I have to pay my bills. So they would forego that. In removing the barriers for mental health care, I first went to our imam, and that was Imam Majid, who was here before, and we started to have a talk with them about addressing this mental health in the Friday khutbah. And so they did, mashallah. they started to talk about mental health care and how important it is to be able to access that and to be able to support your family member if they were going through any kind of struggle, mental health struggle. So I also was able to reach out to our mental health practitioners and let them know what we're doing. You know, I said I'm putting together a mental health program, and I want to know who's interested in coming on board. And the response was absolutely positively humbling, because everyone said yes when they knew that we were developing this through the masjid. The program that we designed was zakat funded because of the fact that I was in social services, so I'm going to be able to provide this to my client without having them worry about a single dollar. We were going to take care of everything. So we designed also an in-house program. So I had thinking about having an on-site therapist as well as myself as the social worker, but I also needed clinical off-site counseling for those that felt more comfortable going off-site, and then creating a provider network. Alhamdulillah, we were able to develop it and get it approved through the masjid. And so our mission is, through the Adams Wellness Center, we aim to provide an innovative platform where we are able to educate, empower, and encourage our community to learn about wellness and their own well-being. And our vision is, the Adams Wellness Center envisions a well-informed community coming together for the purpose of maintaining wellness through awareness and the utilization of resources. The functions of the Wellness Center is, just providing a holistic approach to everything, and providing the space, the safe space to come to your masjid, go pray if you need to, communicate with your community members, and just basically feel safe. We also said we were going to be creating workshops and seminars so that we would have those and bring speakers in the masjid to be able to tackle some tough topics. This is the Wellness Center diagram here, and so you'll see we have the religious counseling, the support groups is something we're working on, because that was one of the biggest challenges. No one wanted to be seen going into a room, sitting in a circle, kind of talking in a support group, so we still have to figure that out. Off-site counseling, on-site counseling, the social worker, and case management. We also added life coaching for those that are just really struggling through life changes. We have a life coach. Addiction services are something we are currently working on, and inshallah, keep us in your dua, signing on addiction specialists, hopefully, and the health and education events. These are some of the seminars that we put on through our masjid. And so the very first one, in order to draw the crowd, we really just called it Maintaining Mental Wellness, and then it shocked them with like a huge, like mental illness or something like that. We called it Maintaining Mental Wellness, and alhamdulillah, about 50 people showed up to this one. And so by the end of the session, it was like a standing room only. I have a lot of clients that are refugees that come in, and I felt it very necessary to kind of honor them and bring their struggle to the forefront. And so we did an event on post-traumatic stress disorder. We also talked about depression. All of my clients come to me speaking about depression and anxiety, and caring for our elders. The overprescription of prescription drugs to our elders is just unbelievable. I don't know how many of you go to your aunties or your grandparents or someone. There's always some big Tupperware that has like a million pill bottles, and nobody knows what in the world is in there. You keep saying, why are you taking this? Why are you taking this? Why are you taking this? That Tupperware scares me so much every time I see it. And so we had even like fall prevention, overprescription of drugs and drug abuse, caring for our elders, and then just. Next question. So the question is, how did you convince the masjid to fund us, especially for the people who are not yet eligible? And there's like another part of this is also, how did you manage to
push back on the stigma?
I really didn't need to convince too much because alhamdulillah, if you know, Imam Majid is here, mashallah. So Imam Majid is a big advocate of mental health, and so are many of our community members. So when I presented it for funding, alhamdulillah, at that time I was working with some people that pushed for it and advocated for it, and so it was able to come about. The zakah eligibility is just like as if you were to go into your county program. I do need to see their taxes, I need to see their pay stubs, because it is a zakah funding. It has to be used according to the zakah guidelines, and so everything is processed as if you were going to the county.
In the interest of time, we're going to try to go with one more question. So for you, they're asking, how did you get the masjid to see, or how did you get the masjid to see the real therapist but not have a personal interest invested in that? That makes sense.
How did I get the therapist? I just had to continue to stress that this was a mental illness. It was not, where people needed to be diagnosed. And what we're doing is we're treating an individual, and they needed to be sent to the right place. And so when we developed our program, alhamdulillah, we have about 12 people in our network. And 12, we have 3 imams, 6 therapists, 1 psychologist, 1 psychiatrist, 1 life coach. And this is the Adams Network. So any therapist working with a client can refer them to the psychiatrist to receive a diagnosis, get their prescriptions if they needed any, and then just continue to collaborate together away from the masjid. And so they didn't have to be inside of the masjid to get their care. It was just I guess the way that we showed it, is it the personal interest of the masjid without the
I can clarify the question.
Yes.
Yeah, I asked the question briefly, what's happening in our masjid is that we're providing the services and we're getting full. Because they want us to keep seeing the clients and free of charge, but how many clients can you absorb? There are 3 of us.
Yeah, that's why I think you have to show that it's not effective to just see a client for, like once or twice. It needed to be a complete treatment program. And so like I showed you in my slide, for us we start with 12 sessions. And that's funded by Adams. The client also holds responsibility, so if they fail to show up to a therapist appointment, then a counseling appointment, then they can be billed for that. So it makes it a more serious endeavor for the client as well. And so we just have to continue to push that this is a treatment, and we're not just sitting across the table speaking with someone. We're actually treating people, and the word treatment really has to be used in more of a humbling way and showing that something is effective within your masjid.
Thank you so much. So we do have to move on, but I just want to say thank you so much for the questions, and can we get a round of applause for